My name is Andreea. I'm a recent graduate of the Bachelor of Science, Biological and Forensic Sciences course at Coventry University, and this is my official video submission for the Master's Program of Medical Visualization and Human Anatomy. My wish to study the Medical Visualization and Human Anatomy MSc program stemmed from the understanding that artistic skill utilized for scientific purposes can be a powerful academic tool. My endeavor to explore this began at Coventry University, where I have been granted the privilege to initiate a cross-college collaboration, and I took part in project-focused activities in the ceramics and clay modeling studios, whilst brushing shoulders with the technology found in Coventry University's data cave. My passion towards how different 3D mediums can be used for communication purposes allowed me to begin creating digital and tangible exemplars of skulls developed using 3D modeling tools ranging from 3D Slicer, Blender, and Nomad to clay casting skulls from a mold of a real-life exemplar obtained from a collaborating museum. These experiences slowly modeled my understanding for the need of visualization tools, marking them as necessary for revolutionizing both teaching and learning applications, as well as communication across many interchangeable fields. After visiting Coventry University's Data Cave, an automatic virtual environment supplied by Animersion UK and ArtAV, where health and care students can access advanced visualization tools and interact with simulated patients by using 3D headsets, I began understanding why programs such as medical visualization and human anatomy can equip students with unique cutting-edge skills and experiences that cannot be rivaled by another course due to its aim of creating technology-focused art and science applications. I continue to gain relevant experience and skills, which I believe could be demonstrative of my interest and ability in the medical visualization field by exploring volumetric visualization through using 3D Slicer and 3D printing. This endeavor began with the amazing opportunity of delivering a guest lecture for the final year Bachelors of Science, Biological and Forensic Sciences students as part of their Forensic Features module. I have constructed my own teaching lecture materials and physical exemplars of 3D printed skulls, as I have used my own DICOM MRI scan files of my partial cranium, as well as CT DICOM files from internet databases, and transformed these in 3D STL files in preparation for 3D printing. As for my undergraduate thesis, I conducted Coventry University's first-of-its-kind project on facial reconstruction by producing a 3D facial reconstruction sculpture from my own partial MRI skull by building on Richard Neve's Manchester technique. The reconstructive process for the sculpture began with creating an STL 3D model using 3D Slicer from a DICOM MRI file of my own partial skull, which encompassed all the cranial landmark regions from the metopian to the zygomaxillary of the zygomatic bones. With the help of Dr. Cicciello from the University of Modena, Italy, the model was then transformed into a full exemplar by adding maxilla and mandibular segments created using a female CT scan within the same age range as the reference candidate. The skull was then 3D printed and the anatomically centered reconstructive process began, utilizing tissue depth markers as well as a detailed forensic anthropology guide for the modeling process and the placement of the facial muscles and features. The aim of the project was to identify to what degree the morphometry of the facial features is impacted when a significant portion of the skull is remodeled, and how this subsequently may affect the identification of the individual. This experience has highlighted the importance of hands-on anatomical practice and knowledge, for which, although I possess the foundation of, I would like to perfect and further explore in a way in which the medical visualization program intended to train through cadaveric prosections. When considering these aspects of the interdisciplinary approach and respect for collaborative research that the medical visualization program presents, undoubtedly, should I have the fantastic opportunity to be part of your team, my skills and desired research topics would come to life in the most spectacular way. Thank you for watching.